Audio test. 1, 2.
Test 1, 2, 3. Test 1, 2, 3.
Good morning, everyone. We will start our meeting in 1 minute. Okay, we will begin. It's just past 9:30. Good morning again to everyone. Bonjour tout le monde. This is the 14th meeting of the Emergency Preparedness and Protective Services Committee. I'd like to begin with a roll call, so I'll turn to our committee coordinator.
Councillor Bradley,
Here.
Councillor Desroches. Councillor Desroches. Councillor Dudas.
Here.
Councillor Devine.
Here.
Councillor Hubley. Councillor Johnson.
Good morning.
Councillor Kelly. Councillor Luloff.
Présent.
Conseillère Plante. Vice Chair Hill. Present. And Chair Brockington.
I'm here.
You have quorum, Mr. Chair.
Thank you. So again, good morning. Today is the first meeting of this committee with our new general manager of Emergency and Protective Services. So welcome, Ryan Perot. This marks a homecoming for Ryan, who's been with the department for many years before briefly leaving to act as the GM of the Strategic Initiatives Department. We look forward to working with you on priorities of this committee going forward. So welcome. On today's agenda, we have a report from the Term of Council Bylaw Review Work Plan, which is the potential regulations for vaping product retailers review. This report recommends licensing requirements that will support public health and safety as well as consumer protection. Staff will present on this item. And we also have two annual reports. Director Gooding will present on the 2023 Public Safety Service Annual Report and the 2023 911 Annual Reports. Timely enough, we are sharing our committee date today with the Great Shakeout Day, an opportunity to learn and practice how to protect yourself during an earthquake. I encourage you to take a moment to practice earthquake drills with your family, friends, and colleagues. Remember to quote, drop or lock, cover, and hold on. This is also a good time to check that your emergency plans and supplies are up to date. I now wish to acknowledge that the City of Ottawa is located on the unceded, never surrendered territory of the Algonquin and Anishinaabe First Nations people. They have been inhabitants and stewards of these lands for millennia, and we honor and recognize them. Okay, are there any declarations of interest for today's meeting? Seeing none, confirmation minutes from committee meeting 13 held on the 19th of September, 2024. I hope everyone's had a chance to review. Are the minutes of the September 19th, 2024 committee meeting confirmed? Thank you. We have presentations on all three substantive items this morning, so we will hold all three items. And those are, again, the review of the potential regulations for vapor product retailers. We'll have a brief update on the Public Safety Service 2023 annual report, as well as the 911 annual report for 2023. So we will begin with item 4.1, which is a review of the potential regulations for vapor product retailers. And I'd like to open with the general manager for introductions.
Good morning. Thank you, Chair, and good morning, members of the committee. Merci, Monsieur le Président. Today, the Public Policy Development Team will present the results of the bylaw review on potential regulations for vapor product retailers. This review is part of the Term of Council Bylaw Review Work Plan and supports a key city strategic initiative of updating and modernizing the city's licensing bylaw. With me are Valerie Bietlo, Manager of Business and Technical Support Services for Emergency and Protective Services, and David Kurz, the Bylaw Review Specialist who led this file. They will explain their findings and proposed recommendations from this regulatory review. Director Roger Chapman from Bylaw and Regulatory Services is here to respond to your questions alongside Valerie and David. Also with us today is Harpreet Grewal, a supervisor in Ottawa Public Health's Community Health and Wellness Branch. Staff have worked very closely with Ottawa Public Health on this file, and Ms. Grewal is here to answer any questions from the public health perspective if necessary. Thank you to the Public Policy Development Team for your hard work on this file, and I will turn it over to you for the presentation. Je remercie l'équipe pour son travail sur ce dossier et je vous laisse la parole pour la présentation.
Thank you. The bylaw review we're presenting today sought to answer the question of whether municipal regulations are necessary for vape product retailers in Ottawa, and if so, what those regulations should look like. To answer that question, we examined several key issues, including the growing number of vape retailers in the city, ongoing non-compliance by retailers, including selling vapor products to youth, enforcement capacity and challenges in this landscape, and how provincial funding for provincial enforcement has affected capacity. And finally, how the city currently regulates tobacco retailers and if there's any lessons to be learned there. As the general manager has noted, the Public Policy Development Team has consulted and worked closely with staff, both in Ottawa Public Health and in Bylaw and Regulatory Services throughout this review, and their input has informed our recommendations. Staff also consulted with tobacco retailers, the known vapor retailers that we're aware of in the city, related industry and business organizations, as well as various advocacy groups to also help inform our recommendations. So now I'll turn it over to David to present the highlights of our report.
Thank you, Valerie. Next slide, please. So what are vapor products exactly? They are products such as electronic cigarettes, which are battery-operated devices, typically containing nicotine and come in a variety of different liquid flavors and aromas. The sale of vapor and tobacco products is co-regulated at both the federal and provincial level. Federally, the Tobacco and Vaping Products Act regulates the manufacture, sale, labeling, and promotion of tobacco and vapor products across Canada. In Ontario, the Smoke-Free Ontario Act, or SFOA, complements the federal legislation and regulates the sale, display, promotion of tobacco and vapor products in retail settings across Ontario. This is the piece of legislation that is enforced by the city. It contains key prohibitions, including prohibiting the sale of products to persons under the age of 19, restricting how customers can view and handle products before purchasing them, and restrictions on the sale of flavored products. To enforce the Smoke-Free Ontario Act in Ottawa, annual funding is provided to Ottawa Public Health from the province. Ottawa Public Health then sends 100% of that funding directly to Bylaw and Regulatory Services to staff tobacco enforcement officers, who are bylaw officers that are authorized to enforce the provincial regulations. In 2024, the amount of funding provided for SFOA enforcement was $250,000, which is used to staff 2 tobacco enforcement officers.
En Ontario, la loi favorisant un Ontario sans fumée complémente la loi fédérale et encadre la vente, l'étalage et la promotion de produits de tabac et de vapotage dans les magasins de détail. Et c'est cette loi provinciale que nous appliquons ici à la municipalité. La loi provinciale interdit la vente de produits de vapotage aux personnes de moins de 19 ans et restreint la façon dont la clientèle peut manipuler les produits avant l'achat et restreint aussi la vente de produits aromatisés. Pour faire appliquer la loi provinciale à Ottawa, Santé publique Ottawa reçoit du financement annuel de la province. Les fonds sont ensuite versés directement aux services de règlement municipaux pour payer les agents d'application de la législation provinciale anti-tabac. En 2024, le financement provincial était à 250 000, qui a servi à embaucher 2 agents d'application de la législation anti-tabac de façon locale. Next slide, please.
Retailers of vapor products in Ottawa can be broken down into 3 categories. First are licensed tobacco vendors. There are approximately 365 tobacco vendors licensed by the city. Staff are aware that about 85 to 90% of vendors also sell vapor products. As most licensed tobacco vendors are businesses such as gas stations and convenience stores, there are no age restrictions in terms of who is allowed to access these stores. Under the SFOA, these more traditional types of retailers are limited in the variety of vape products they can sell, meaning only tobacco, menthol, or mint flavors. Secondly, there are specialty vape stores, which are retail establishments that exclusively sell vape products and accessories. Specialty vape stores do not currently require a business license from the city. However, to be considered a specialty retailer under the SFOA, a store must be registered with Ottawa Public Health. There is no cost associated with registration, and there are currently 71 specialty vape stores registered in Ottawa. Much like cannabis retailers, access to specialty vape stores is restricted to persons over the age of 19. Specialty stores are permitted to sell a wider variety of products, including fruit and candy flavored products, and customers are also allowed to sample and test products inside the store. Lastly, there is a smaller number of retailers that are known to sell vapor products, among other smoking and vape accessories. These retailers are not licensed by the city as a tobacco vendor, nor are they registered with public health as a specialty vape store. However, they are subject to inspection under the SFOA. As there are no licensing or self-identification requirements for these retailers, the exact number of them is unknown. However, enforcement staff estimate that there are only a small handful currently in operation. Next slide, please. As noted by Valerie, staff examined several key issues as part of this review. The city has seen significant growth in the number of vapor product retailers. Approximately 85 to 90% of licensed tobacco vendors are also selling vape products. There has also been a significant increase in the number of specialty vape stores operating in the city, which has gone from 19 specialty stores operating at the beginning of 2019 to 71 stores currently. Recent enforcement data has shown ongoing non-compliance by retailers with SFOA regulations. Over the last few years, the number of charges issued to retailers related to vapor products have outnumbered the amount of charges issued for tobacco products. There is a particular concern with respect to the sale of products to minors. The number of charges for selling vapor products to minors has been increasing. Specifically, it has increased from 31 charges in 2022, 41 charges in 2023, and 28 charges as of June 30th, 2024. Next, staff have noted that enforcement capacity for the SFOA has been challenged by a decrease in overall provincial funding for SFOA enforcement. In other words, provincial funding for this enforcement has not kept pace with the growing number of retailers or the availability of vapor products. The current funding amount of $250,000 means that there are currently only 2 tobacco enforcement officers enforcing the SFOA in Ottawa, whereas in the past, the city has operated with as many as 4. In previous years, Ottawa Public Health has supplemented base funding received from the province with other provincial funding sources, such as cannabis funding, to increase the total amount provided to bylaw and regulatory services. However, additional funding from the province is no longer provided. Finally, there are also public health concerns associated with vaping, especially with respect to youth, due to the high amounts of nicotine in these products. We know that this can lead to physical dependencies and addictions, including a transition to cigarettes. According to the 2023 Ontario Student Drug Use and Health Survey from the Centre for Addiction and Mental Health, the prevalence of vaping among Ontario students in grades 7 through 12 is substantially higher than tobacco cigarette smoking. The study also noted that vaping products are some of the most readily available substances for students. Next slide, please. As a result of these issues and challenges, staff have sought a regulatory solution to boost compliance and enforcement. 2 recommendations are being brought forward. The first recommendation is to establish a business license requirement for vapor product retailers in Ottawa. The benefits of a licensing requirement are that it will provide the city with additional enforcement tools and resources to address the issues identified and help support the city's ongoing SFOA enforcement efforts. First, in terms of enforcement tools, As a condition of holding a license, retailers must comply at all times with all federal and provincial regulations, including the Smoke-Free Ontario Act. Non-compliance can be addressed through licensing enforcement. This will ensure accountability on each retailer to maintain compliance with all regulations and ensure that their municipal license remains in good standing. Licensing also forces all retailers to self-identify, which will give staff a more accurate picture of who the retailers are, where they're located, and the types of products they're selling. In terms of enforcement resources, revenue from licensing fees will allow for one additional licensing enforcement resource in bylaw and regulatory services on a full cost recovery basis. While this resource would not be a tobacco enforcement officer, this officer will manage and enforce the licensing regime for vapor retailers, which will help support the work of tobacco enforcement officers. Licensing will also place vapor product retailers on a regulatory level playing field with tobacco retailers, who are currently regulated under both the provincial SFOA and the city's licensing bylaw.
Nous recommandons un nouveau régime de permis d'entreprise pour les détaillants de produits de vapotage, similaire à celui qui est déjà en vigueur pour les vendeurs de tabac. Les recettes découlant des droits de permis permettront au service de règlement d'embaucher une personne supplémentaire pour l'application des règles de permis, ce qui facilitera le travail des agents d'application de la législation provinciale anti-tabac. L'obtention d'un permis placera aussi les détaillants de produits de vapotage à un pied d'égalité avec les détaillants de produits de tabac qui font déjà l'objet d'un encadrement provincial et municipal.
The second recommendation is outside the licensing and regulatory regime and is more about advocacy. Staff are recommending that council requests that the province amend the Smoke-Free Ontario Act to extend prohibition orders to vapor product sales offenses. Currently, the SFOA only allows prohibition orders for tobacco sales offenses. Expanding the scope of prohibition orders to include vapor product sales offenses would provide an extra and significant enforcement tool at the provincial level. This recommendation was specifically flagged through consultation with the city's tobacco enforcement officers and also aligns with a resolution from the Ontario Association of Local Public Health Agencies, which called for the same legislative amendment. This resolution was supported by Ottawa Public Health. Next slide. As with all licensed businesses in the city, an annual license fee would be required by each vapor product retailer. For any retailers that sell only tobacco products, there would be no change or increase to their current license fee of $930. For any retailer selling only vapor products, such as a specialty vape store, a new vapor product retailer license would be required. The proposed license fee for these retailers is $930, which would mirror the current tobacco vendor fee. For any retailer that sells both tobacco products and vapor products, a new tobacco and vapor products retailer license would be required. The recommended license fee is $1,092, which is an increase of $162 to the current tobacco vendor licensing fee. This fee increase, as well as the new fee for standalone vape retailers, have been developed to fully recover the city's costs of administering, managing, and enforcing the new licensing regime.
Comme pour toutes les entreprises titulaires d'un permis, les détaillants de produits de vapotage devront payer des droits de permis annuels. Les droits de permis pour les détaillants ne vendant que des produits de tabac ne changeront pas. Les droits de permis pour eux restent fixés à $930. Les détaillants ne vendant que des produits de vapotage, comme les boutiques spécialisées, devront obtenir leur propre permis et les droits de $930 sont proposés, soit les mêmes que ceux imposés aux vendeurs de tabac. Les détaillants de tabac qui vendent également des produits de vapotage verront leurs droits de permis augmenter d'environ $162, soit un droit de permis annuel de $1,092. Ces droits sont fixés d'après le principe de récupération des coûts pour l'administration, la gestion et l'application des règlements de permis. Next slide, please.
Staff recommend that the new license requirements and associated fees be implemented as of November 30th, 2024. This is the date that all current tobacco vendor licenses are set to expire. This would allow for an easy transition into the new system. Staff have communicated with impacted retailers to advise them of the proposed fees and implementation date. Should the recommendations be approved by committee and council, further communications and information would be provided to retailers. Licensing application and requirements will also be posted online on the city's webpage. Thank you.
And that concludes your report. So thank you very much. We appreciate that. Before we entertain questions from committee members, we do have a delegation that we will receive at this point. I will note for committee members that we did not receive any written submissions for this particular item, but as I said, we do have a delegation. So I will call on Mr. Ron Couchman, owner Clear Sky Vapes. Not sure if he's online or present in person. We're just taking, all right, he is online.
Can anybody hear me?
Yes, sir. Welcome. You do have 5 minutes to speak, and when you have 1 minute left, I'll just say 1 minute.
Thank you very much. First, I'm not just a vape store owner. Before that, I worked with the City of Ottawa under crime prevention for a lot of funded projects on violence prevention. I created a program called I Can Manifest Change that prevented and ended violence against women, and it's been ongoing in Ottawa for 8 or 10 years after. I say that because my interest originally in the vape industry is one specifically of harm reduction. I had very little interest in becoming a retailer. It's kind of just an advocacy. It kind of extended from me getting people to quit smoking. And I worked many years on harm reduction in Toronto for White Ribbon. So harm reduction is sort of the crux of what I do. First, I want to appreciate I've been advocating for tighter reins around harm reduction, around tobacco, specifically for a long time, specifically for the protection around youth. I want to acknowledge first that SOFA, the Smoke Free Ontario Act, the update that started the vape industry from being regulated under their purview, is a single piece of legislation that began making vapes accessible to youth. Up to that point, youth had to enter 19+ vape shops only. There was no other avenue to get vapor products legally. And at that point, the highest level of nicotine that the industry chose to sell was 24 milligrams. The concept of having 50 milligram nicotine didn't exist before SOFA allowed corner stores and gas stations to start selling vapor products. And then it was birthed when like Juul and Stealth Pods started coming out, and they do ridiculous high milligrams that were never needed in the industry to begin with. And these companies are owned by Big Tobacco. So it was their play to try to get a grip on an industry that has been dedicated to harm reduction up until that point. Up until that point, we operated outside the purview of laws. It was a gray area. There was no law against selling nicotine. There was no law specifically allowing it. Once it became legal, corner stores and gas stations proliferated vaping on a much major scale. Youth no longer had to go to 19+ vape shops to get products. And it was only then that we hear the first instances, about 7-8 years ago, where use on a broad scale started vaping. I operated my store 6-7 years before that, and I never once heard of vaping being used. Did youth experiment? Absolutely. And youth will continue to experiment. We have to acknowledge also that before vaping entered the market, almost all the youth that currently vape, the same number, I shouldn't say the same youth, the same number used to smoke. Vaping has made smoking not cool in schools, something the government was completely incapable of doing for 30 years previous to that. Do I wish vaping wasn't in the hands of children? Absolutely. The reality is they smoke, they do drugs, they take weed, which theoretically they're also getting from government supplied vape shops or from cannabis stores. I apologize. Youth will experiment, and it is problematic. I agree. I wish that it wasn't the case. If people had to go to 19+ vape shops in order to get vapor products, and that was the only avenue, then I completely agree with you. It would make sense to regulate them very heavily. 80% of youth that order vapor products order them direct from China, get them shipped to the house, and it costs them absolutely nothing. So we have to acknowledge that, first of all, a lot of youth are vaping and they're not necessarily getting it from vape shops. There is a small percentage of people that are, and that will happen in every regulated industry, right? Second of all, if we are talking about a fee, my biggest problem is there isn't really a consulting with the industry, right? The city of Ottawa simply sends out a survey to people who are really not involved with checking their email every day. We're focused on running a business, and our only avenue of connecting with the city is an emailed survey on our opinion on the matter. Which, granted, there's only a limited number of ways you can reach out. First of all, the SOFA's funding to Ottawa will increase because the province just initiated a brand new excise tax, which is going to rival the federal excise tax. Just to give you a ballpark, I was hoping to share a screen with you momentarily. It should be really quick. I'm not allowed to. So if I were to order, for example, $700 worth of wholesale products right now, under the federal excise tax on that $700, I pay $1,841 in federal excise tax. And I pay another $1,840 on Ontario excise tax. On a $700 order, don't forget. And then on that, I pay HST of $578 because they collect HST on the excise tax, which under Canadian law is already illegal. You're not supposed to be taxed on a tax.
Mr. Couchman, I'm just going to jump in. You've come to the end of your 5 minutes. I do want to see if any colleagues have questions for you, if there's any items. I don't see any hands. So we're just going to end it there this morning. If there's anything that you'd like to share with committee members, if this matter passes today, there's still some time before the matter gets to council. So if there's any follow-up material you wish to email or send, and I'll certainly ensure through the committee coordinator that be sent to committee members. But thank you for your presentation. I don't see any questions for our delegate today. So we will now transition to questions to staff from committee members. And Vice Chair Hill, you are first.
Thank you. Just to follow up on Mr. Couchman's delegation, could you speak a little bit to the direct-to-house shipping issue and regulation and how we could potentially look at that, or how you are looking at that?
I think as excise tax increased, that's the biggest problem is black market.
Mr. Couchman, thank you. Your delegation is over. The questions are now to staff. Thank you. Go ahead.
Mr. Chair, yes. Under the SFOA, it is illegal to sell or supply products to persons under 19, even online products. However, the online piece of the SFOA is not something that we regulate at the municipal level, and Mr. Chapman can speak more to that. I can say that the province of Ontario has indicated that they wish to crack down on online sales and illegal online sales. My understanding is that they are trying to work with partners such as courier companies to set up more stopgap measures, for example, checking ID before a vapor product is actually delivered to the customer. My understanding is that federal inspectors under the federal law have the ability to inspect online premises or premises from which online businesses are run, and they can take action federally.
Is there anything more that we need to do in terms of advocacy or engagement with other levels of government if this is an issue that we want to further engage on?
Mr. Chair, my impression is that the rules are there. It's certainly something that we could take away and seek to address with the province to see what progress is made from their perspective.
Okay, thank you. I was struck in the report when you referred to enforcement data showing continued non-compliance by retails, notably in the area of youth access. What do we project the public health impact will be by implementing these policies, particularly as it pertains to minors using vape products?
Good morning, Mr. Chair. Thank you for the question, Councillor. Certainly the increased by one resource will certainly help support the TEOs and their efforts to limit the sale of vape products and tobacco products to minors, particularly around the schools. And that's where we're seeing an increase in sales, and that's a real concern. So that's where we're focusing our enforcement currently.
I think a lot of people reading about this policy in the news will be supportive, but they may wonder how a $930 or 1,900 or 1,092 licensing fee is going to be big enough to convince bad actors to cut it out. Can you speak to how the licensing fees enhance your enforcement efforts?
Mr. Chair, again, thank you for the question, Councillor. Certainly, we've been collecting licensing fees for tobacco licensing for a number of years now. Those licensing fees offset the enforcement costs. But what we found recently is that the cost of enforcement outweighs the cost of actually the licensing fees. So this increase in licensing fees, this nominal increase in licensing fees will help fund an additional resource so that we can tackle the issue of sales to minors in particular. That's our biggest concern right now is the sales to minors.
Thank you very much, Mr. Chair.
Thank you, Vice Chair. Councillor Dudas, you are next.
Thank you very much, Chair. I just wanted to understand a little bit more about the shortfall in terms of the provincial funding through OPH to our bylaw. Is even with the licensing fees that are being proposed for approval today, you mentioned, Mr. Chapman, that will cover one additional resource. Do you think that is going to be sufficient? Is there still a shortfall in funding even if these fees are implemented?
Mr. Chair, Councillor, thank you for the question. So I'll start by saying that, keeping in mind that these licensing fees that we're collecting are to fund a licensing enforcement officer, unrelated to the funding of the tobacco enforcement officer. So the role of this licensing officer will help to support those TEOs, but certainly it's not increasing the number of TEOs that are doing the enforcement of the SFOA.
So just to be absolutely clear, I fully will be supporting what is being recommended by staff in this report. I guess I keep going back to the fact that the province is requiring the municipality, asking the municipality to enforce its legislation, and yet it's not providing enough funding to enforce the legislation. Which I think seems to be a recurring theme, not only in this committee here, but in other avenues that the city has to face. So I was just trying to wrap my head around if you have enough funding / resources as provided through the province to do the job you need to do to keep up with the demand out there. But it seems like it's two different avenues that you're looking at, and that might be something that is addressed in the second recommendation in this report. Is that correct?
Mr. Chair, thank you for the question, Councillor. We've had as many as 4 tobacco enforcement officers in the past. Certainly, the enforcement activity hasn't been reduced over the last year or so. So, to directly answer your question, do we have enough TEOs to enforce the provincial regulations? I think the simple answer is that that's a bit of a struggle. There has been an adjustment to the service level agreement with Ottawa Public Health to ensure that we can meet those the levels that are set in the agreement. And again, we prioritize where we make our enforcement efforts. So as I said previously, the TEOs right now are focusing on tobacco retailers that we have continued non-compliance, particularly around the schools and particularly more specifically to sales to minors.
Thank you very much, Mr. Chapman. Thank you, Chair.
Thank you, Councillor. Councillor Devine and then Deloche.
Thank you, Chair. Thank you, staff, for the presentation and for the briefing that you arranged with councillors last week or so. I'm not at all surprised, and I'm happy to see that OPH is fully supportive of what you're trying to do. And just so I can have crystal clarity here, I appreciate that my colleagues are wondering why is this falling to this method. of paying for enforcement as opposed to the province. But I don't think we necessarily have a lever to pull at the province to increase their funding towards vaping licensing. But just so I'm clear, the revenues that you're going to be pulling from vape retailers is going to go directly and strictly to the addition of 1 or 2 enforcement officers for vaping. Is that correct?
Mr. Chair, yes, that's correct.
And so if the province is not going to be paying for it, this is certainly not a burden on the taxpayers. This is going to be industry itself contributing the funds to police industry.
Mr. Chair, yes, that's correct.
And as I heard from the delegate earlier, there is a growing prevalence of youth being attracted to this product, and that this enforcement is going to be focused as much as you can with 1 additional officer on trying to target enforcement towards those, not enforcement, but licensing and enforcement, largely towards retailers that might be selling to that vulnerable population.
Yes, Mr. Chair, that's correct.
Thank you very much. Go for it.
Thank you, Councillor. Councillor Deroche.
Yeah, thank you, Chair. I think there's some good work here that have been undertaken by staff. I think whenever we regulate, we have to clearly demonstrate that the regulatory regime is warranted and that there is a serious problem. I'm not thrilled that we're filling a provincial gap, but I think given the severity of it, I think it's important that we take action. We're, I think, reaching a point where we potentially have some retailers that would sell now alcohol, tobacco, and vaping. And I'm just wondering from staff how we will coordinate those types of inspections, or that, maybe down the road, we look at sort of having 1 inspection regime or 1 licensing regime that responds to all 3 of those. So again, this is a new development that you've got alcohol and beer sold in some retail locations. So I'm just wondering how we would coordinate those 3 areas that are regulated.
Mr. Chair, what we've sought to do with this report is actually coordinate the licensing regime between the vendors that sell tobacco products, vapor products, or both. So we're presenting sort of a package deal in terms of those licensing permits and the fees that work together. The city does not currently inspect for alcohol sales or displays. That is entirely provincial regulation. So that is not something we have to worry about currently.
How would a member of the public, if they observe, for example, a sale transaction, like I said, there's now locations that are not just dedicated to these products. If they observe what they suspect was service to a youth or a sale to a youth, what's the recourse for a member of the public to identify that?
Chair, thank you for the question, Councillor. I would suggest that those would be complaints that they should file directly with the Ottawa Police Service to investigate.
Sorry, if they suspected a vaping product sale was
Sorry,
sold to a
you were
youth?
talking about alcohol sales.
No, sorry. Yeah, no, vaping. Under this current regime. Sorry, I should have clarified.
My apologies, Mr. Chair. Councillor, if that's the case, if they witness sales to minors or what they think is sales to minors, I would suggest that the best way to is either through ottawa.ca or through 311 to file a complaint, and which will be assigned to either a tobacco enforcement officer or the licensing officer to follow up and conduct the investigation.
Okay, that's helpful. And then lastly, on the request for the prohibition powers, it strikes me that if we are regulating this industry and we have a high level of non-compliance with a particular retailer, that we would potentially revoke their license, their city license, and as a result of that, they would be in a situation where they wouldn't be able to sell, I would think. So I'm just wondering why we need the additional prohibition powers if we potentially have that ability now with this regime.
Mr. Chair, Councillor, again, thank you for the question. Currently, there is no means to apply to the province for a prohibition order related to the sale of vape products under the Smoke-Free Ontario Act. So recommendation 2 is specifically about asking the provincial government to provide those powers.
Right, but under our regime, under the municipal regime, if approved, if there's high levels of non-compliance with a particular retailer, would we take steps to revoke the license and thereby prohibiting the sale?
Mr. Chair, yes, Councillor, it would, the new licensing regime would allow for the ability to either suspend or revoke a retailer's license for continued non-compliance. So we would request a review, status review before the licensing committee, if that was the case.
Right, I had understood that the prohibition powers really bring greater legal clarity, right? Because we know we will have wily lawyers that come into to cases where they would argue we don't have jurisdiction or what have you. So that's what I had understood, that going in there gives us a greater legal basis should we need to deal with high levels of non-compliance with the retailers. So again, appreciate the answers today, and I'll be supporting the package going forward. Thank you.
Thank you, Councillor, for that. I do understand, I don't see any other speakers, so I do want to ask one question. And understand Ms. Grewal is here from Ottawa Public Health. If I may ask you a question, and that is, if you could please elaborate on, first of all, does OPH acknowledge that there's a growing problem of vaping with youth under 19? And secondly, what are the proactive measures that Ottawa Public Health are undertaking, specifically targeting youth and some of the health challenges related to vaping?
Thank you for the question. And through you, Chair, yes, there is a growing challenge in relationship to youth and vaping, and we are taking additional measures to address prevention, harm reduction, and cessation efforts. For example, we have recently submitted consultations to Health Canada and notices of intent, and we're really putting forward some additional recommendations, including the requirement for all provinces and territories to ensure tobacco product retailers are obtaining smoking cessation training and health information, including vaping cessation training, to ensure that they're meeting provincial requirements surrounding the sale of commercial tobacco and vaping products through their establishments. We're also hoping that the recommendation that we also put forward around restricting product website links or ads to social media or website advertising to users who are underage. And we're hoping also that there's more monitoring and mitigation and the return of smoking and other nicotine product placements in new and unregulated media. Locally, we are working with our school boards, our community partners, and many other agencies. We've launched the youth education module, which is available on our OLearn platform, which is accessible to everyone. And we're really focusing on the content in there surrounding tobacco, cannabis, vaping, health-related risks, where people can find help, and the Smoke-Free Ontario regulations. And we also provide multilingual resources and are going into fifth quintile neighborhoods where we're really presenting on the health effects related to vaping.
Excellent. Thank you so much for
Thank
that
you.
thorough reply. It is appreciated. Okay, seeing no other questions from committee members, the recommendations before us are: 1, that the committee approve amendments to the city's licensing bylaw number 2002-189 as amended to establish regulations for the licensing of vapor product retailers as described in the report and in general form set out in document 1. And that item 2, that City Council direct the city clerk to write to the Premier of Ontario and the Minister Ontario Minister of Health, to recommend an amendment to Section 22 of the Smoke-Free Ontario Act 2017 to include vapor product sales offenses within automatic prohibition order applications as described in this report. Is this item carried?
Carried.
Thank you, colleagues, and thank you to staff for the presentation and your good work on this item. Okay, we'll transition now to 4.2, which is the Public Safety Service 2023 Annual Report. Director Gooding will join us. As staff get prepared, I'll just note for the committee that we have not received any written submissions on this item, and we have no registered speakers. So there'll be a brief staff presentation, and then we'll open it right up to questions. So General Manager for introductions.
Thank you, Mr. Chair. So the presentation before you today is a combination of both item 4.2 and 4.3. So the Public Safety Services 2023 Annual Report and the 911 Annual Report as well. So I'm very proud of the work of the Public Safety Service throughout 2023. Je suis très fier du travail réalisé par le Service de la Sécurité publique tout au long de 2023. Staff have successfully adapted to the evolving work environment and changing service demands while ensuring program requirements were also met. In 2023, the Office of Emergency Management focused on both internal and external preparedness by prioritizing training, communication, and partnership building. Meanwhile, corporate security returned to pre-pandemic activity levels at city facilities, and we're committed to providing great support to clients in our evolving landscape. Corporate radio also experienced increased activity with over 7,000 radios now registered on the network. The team continues to ensure a reliable public safety grade radio service for first responders and other frontline users. The 911 service remains vital for residents of Ottawa, with operators ready to assist anyone in need. I want to thank staff for their dedication in maintaining this essential service and for their unwavering support when it matters most. These achievements, along with many others highlighted in these reports, reflect the team's commitment to the well-being and safety of Ottawa residents. Ces réalisations et celles soulignées dans les rapports reflètent l'engagement de l'équipe envers le bien-être et la sécurité des résidents d'Ottawa. Thank you to everyone for your hard work and dedication. Now I'll hand it over to Beth Gooding, Director of Public Safety Service, for the presentations.
Thank you for the opportunity to present this morning. We can go to the next slide. Donc, je vais commencer en vous rappelant que le service de sécurité publique est responsable de gérer les situations d'urgence, la sécurité physique aux installations municipales et aussi le système de radiocommunication municipale. On est aussi responsable de gérer les fonctions de prise d'appel au 911, mais comme vous le savez, on va discuter le service 911 séparément ce matin. En tant que l'environnement opérationnel, 2023 fut un mélange d'opportunités et de risques, comme toujours. So 2023, in terms of our operating context, was a mix, as always, of opportunities and risks. In terms of challenges, we continue to face an ongoing climate change crisis and affordability crisis, and those can have direct and indirect impacts on our programming. What we're also seeing, though, is that those challenges are really proving to be important calls to action for our partners, both internal and external. There was a lot of energy and goodwill around the table to work together to look at things differently and to frankly improve our programming. And I'll be providing a couple of examples of that at the end of the presentation. Next slide. So this is just a quick reminder that the Public Safety Service includes a small but mighty team managed by Denis Crête, who oversee our corporate radio system. So this is a very important public safety grade communication system used by our frontline workers, as well as some external city partners. And we always like to remind people that this is a really critical communication system for our Transit Services Department because it's the only reliable mode of communications in our LRT tunnels. So we work very closely with them. Next slide. Voici un sommaire des incidents de sécurité depuis 2018. Comme vous pouvez voir, les incidents ont pris de l'ampleur un peu depuis la pandémie, mais je pense que c'est normal quand on considère l'environnement opérationnel que j'ai décrit auparavant. L'important ici, c'est qu'on travaille très étroitement avec nos partenaires internes et externes afin de évoluer notre programmatique pour mieux gérer les risques. Et je vais fournir un exemple de ça à la fin de la présentation. Next slide. Oh, I'm sorry. I also wanted to mention that our corporate security program is managed by Clayton Foster and also Catherine Zuccato, who manages our security systems. Sorry about that. So here's an overview of the main emergencies that we coordinated in 2023. And some people get surprised when we include things like Canada Day or a presidential visit, but it's a good reminder that an emergency is any planned or unplanned event which can impact residents and city services and for which some preparation is necessary. The Office of Emergency Management is another small but mighty team managed by Dan Bizanet. And in addition to coordinating our emergency response and recovery efforts, they also in 2023 met all of our provincial reporting requirements and maintained a rigorous training program within the city. Next slide. So this is our last slide. We just wanted to look ahead to priorities for 2024 and ongoing. As I mentioned earlier, in terms of our corporate security programming, one of the things that we're doing more of is focusing on information sharing and education. So what you'll see over the next year and more is more information sharing, more training, more drills and exercise. It's a foundational element of any corporate security program. I wanted to end the presentation by highlighting 3 priorities that we're working on for emergency management, because I know that this is a file for which many of you have a passion. So we are always focused on 3 things. Communications, number 1. Number 2 is partnerships. And number 3 is building community level resiliency. So from a communications perspective, we're always working on initiatives to enhance information sharing and help residents be better prepared. And that includes ongoing work on our ottawa.ca website. From a partnerships perspective, we're always looking to expand the breadth and depth of the supports we have available to help residents during an emergency response and recovery effort. And so just to give you a concrete example, we are working to sign new agreements with both St. John's Ambulance and Team Rubicon this year. These are well-established volunteer agencies, boots on the ground. They have locally based volunteers who are ready to help. And so this is something that we're excited about. And in terms of building community resiliency, it's really twofold. And I've had many conversations with you about this. We want to make sure that we understand the diverse needs of the different segments of our population during emergencies. So we know, for example, that rural residents experience emergencies differently. People with disabilities may have unique needs. People who face barriers to opportunity may need additional support. So we are always engaging to better understand the needs of the different members of our community and so that we can address our programming to meet them. And the other aspect of the community level resiliency is, again, something that I've mentioned over and over again, but we continue to engage with community associations, faith-based groups, and other local entities to really build that neighborhood level capacity. It's really important during especially a large-scale emergency response like the derecho for neighbors to help neighbors. And so we continue to go out there and engage and help communities develop local level plans. I'll end with what I think should be the vision for the city's emergency management programming, which is that, you know, in a city like Ottawa, no one should ever suffer during an emergency. So I think that our guiding light should be to continue to work with a range of partners to find the people who need our support the most and to deliver it to them during an emergencies most efficiently. Donc, merci beaucoup. I'm going to hand it back to the chair.
Thank you, Director Gooding, for the annual report. We appreciate the work that you do, very important work for our city. And I'll open it up to questions at this point, starting with Councillor Johnson. No.
So, compared to last year, I actually have fewer questions on the emergency management side, which is, I'm sure, a relief to everyone. Thank you to everyone's knocking wood at the same time, I hope, on that one. But thank you to Mother Nature for a different kind of year in 2024 that hasn't provoked the same 2023 report. I just wanted to sort of connect on some of the corporate security response items that you've described in your presentation today. So we wonder how staff could consider using the possibility of Teams as an internal messaging tool when there's a corporate security issue. We've had some circumstances over here in the West End where we haven't had the same consistent kind of communication across all members of a team. And I wonder if that tool is something that's being considered to, blanket a message, make it consistent, make sure that everyone knows what they're supposed to do internally.
Thank you, Mr. Chair, for the question. It's an excellent one. So there have been some security incidents in the West End over the past year in particular, and one of our lessons observed is that we do need to issue communications more quickly. So we have been working with our partners in Recreation, Cultural and Facility Services Department to develop pre-canned messaging that we can tweak really quickly and send out in both official languages as fast as possible. Our messaging is meant to explain very quickly what's happening and give any advice that's necessary. And so that's something that we are working on already. The other thing that we're doing through the Office of Emergency Management is working on that public emergency notification system. So once that's in place, we can also use it actually to communicate to staff.
And do you imagine that that would be a separate platform when you describe that you're working with Parks and Rec, or is it something that is easily procured?
So for Parks and Rec, we're using email messaging. For the Office of Emergency Management, it'd be text messages.
Okay.
So we'll be covering two modes of communication.
Okay, very good. And what level of incident triggers a formal debrief and review of process?
From a security perspective, really any security incident requires, at a minimum, a debrief process internally, and that is what we do. So whenever there's a security incident, we meet to review what happened, look to see what mitigations we can put in place to prevent it and deter it from reoccurring.
Okay. And I wonder, with respect to the corporate security response, what kind of training and oversight do we have, for example, the security guards that we have in our buildings, so that they understand the degree to which they have authority or powers to intervene or act upon members of the public, just so that everyone's really clear what they can and cannot do? Because I have understood that sometimes there's some unevenness in that practice as well.
Thank you for the question, Mr. Chair. So our security guards are all consistently trained. That includes things like cultural sensitivity, bias awareness, nonviolent crisis intervention, as well as things like use of force. Their purview is to use, the minimum actions required to de-escalate a situation. And that is the guidance that we give and will continue to give.
Okay, very good. And they would be included in any kind of these formal debrief review of process as a stakeholder, I would assume?
That's right. And normally, because they're on the front lines, they are usually the ones writing the incident report.
Okay. And can you describe, final question, Chair, could you describe for me sort of what the balance is between wanting to keep some of these corporate security processes internal to, you know, staff and to the GM oversight because of the security risk to making it more public versus sharing the lessons learned with other stakeholders such as councillors?
Thank you, Mr. Chair. It's an excellent question, and that is something that we're thinking about as part of our broader information sharing and education initiatives. So, for example, following the stabbing at the Mary Pitt Center in May, the tragic stabbing, we did do a formal debrief internally with our one of our governance committees at the city. We are happy to extend our lessons observed to other groups as appropriate. And we actually want to do more of this information sharing because I think it's important in terms of the culture of learning in our organization.
And where, may I ask, is, sorry, I lied. I just have a follow-up because of and I know that we're talking about a 2023 report, but because we brought up the Mary Pitt Center specifically, if I might ask, how does emergency management and corporate security response inform the manner in which we take care of our employees when something like that happens on site at a place of work? Because that deeply upsetting event, and we have employees that will never be the same. And, you know, we sort of issued a one-time kind of check-in when it happened, but, you know, we're actually almost, you know, we're several months out, and I wonder what kind of regularity we check in on our employees when they have that kind of traumatic incident on site at a facility, and how do you inform those types of supports?
Thank you, Mr. Chair. It's such an important question, and you're right to link it to both our corporate security programming and our Office of Emergency Management. We work very closely with our human resources team for all situations, and paying very close attention to the impacts on staff. When the Emergency Operations Center is mobilized, for example, we do have a formal safety officer position in the EOC who is responsible for staff health and safety. That concept, though, extends to security incidents as well. Like I said, we work very closely with HR to make sure that staff get the supports they need. We did the same for our contracted security guards. And as part of the debrief that I made to that governance committee, we made sure that managers knew of their responsibilities for ongoing monitoring and supports. Okay. And so this is something that we're going to continue to work on, continue to improve on, but it's top of mind for both security and emergency management.
Great. Thank you very much, Chair.
Thank you, Councillor. Great questions. Vice Chair Hill, you were next.
Thank you. I really just want to say thank you for all the hard work done over the last year and just highlight the fact that I'm extremely pleased to see the progress that you've made with Team Rubicon. Obviously, as former military myself and in my capacity with the Ottawa Veterans Task Force, I'm very happy to offer my assistance if there's anything that I can do, whether it be in coordinating with other military stakeholders, veteran stakeholders and such, in order to make that a successful partnership. I know a lot of those guys personally, and they really take pride in helping their community when they can. So I think that's going to be a great relationship. Thank you.
Thank you, Vice Chair. If I may, the document, Are You Ready, is an excellent document. I've ordered some through you. I hope they arrive soon. How can we more broadly distribute this document, having piles in our community centers, libraries, even non-city facilities where we know have a number of members of the public come, even target approach? You had mentioned there are sort of targeted groups that we have sort of an elevated concern for, particularly in in, weather events or other disasters. Do you have the budget to significantly produce more copies of Are You Ready? And what are your thoughts on sort of a broader distribution?
Thank you for the question, Mr. Chair. It's a great opportunity for me to mention that we are actually updating the Are You Ready brochure. We want to make sure that it stays as relevant as possible. And so we're making some small tweaks, including to the look and feel. We do have the capacity to distribute it more broadly. I also wanted to make a plug that it is available not only in both official languages, but in Arabic, Simple Chinese, Spanish, Cyrillic, and a couple of other languages. And so we're expanding the languages that we have available as well. We are happy to distribute physical copies. What we find is that it's a small enough brochure that people will take it home and use it and reference it, which is great. But as I mentioned earlier, we are also updating our preparedness page on the ottawa.ca website, and we'd like to make that a one-stop shop for emergency preparedness as well.
Excellent, thank you. Okay, seeing no other questions, the recommendation before us is that the committee recommend the council that one, we receive the Public Safety Service 2023 annual report and information, and two, approve the proposed emergency management program bylaw as described in this report and in the general form set out in document 1, and repeal bylaw 2018-98. Are those recommendations carried?
Carried.
All right, thank you very much, colleagues. Thank you, Director Gooding, but do not go anywhere because we still have the 911 annual report. Any further introductions?
No, Chair.
All right, so we will welcome staff who are presenting on this matter. And while we are waiting, I'll just note that we have no written submissions on this item, and we do have one registered delegate to speak. So we'll receive the staff presentation first, go to our delegate, and then questions to staff. So Director Gooding, you want to introduce your colleague and then proceed with your presentation.
Thank you for the opportunity to present. We have Mr. Eric Janis beside me. He is the Director of the Communications Branch at the Ottawa Police Service, and he's joining us today to take part in the discussion after the briefing.
Great, thank you. Welcome, sir. So will you begin, Director?
Yeah, we can jump into the next slide. Le service de sécurité publique de la ville est responsable de gérer le contrat de service technique de 911 avec Bell Canada, ainsi que l'entente de prestation avec la Commission de services de police d'Ottawa pour la fonction de prise d'appel au 911 de la ville. Il s'agit donc d'un partenariat entre la ville et la police. Assez historique. C'est un partenariat qui dure maintenant depuis 35 ans. Et le but de la fonction de prise d'appel au 911 est vraiment de répondre aux besoins des résidents de la ville aussi vite que possible. Next slide. So the table here shows our call volume statistics for 2023. You'll see that it was a bit of an anomalous year in that we had an 18% increase in call volume. It's important to unpack this because this is due to two separate things. Year over year, we do expect regular call volume growth as a result of things like population increases, changes in sociodemographics. We expect a regular growth related to that in the field of about maybe 9 to 10% a year. But in 2023, we had growth above and beyond that because of a software glitch that was affecting cell phones and other devices across North America that resulted in erroneous calls to 911. And so, like I said, it wasn't just in Ottawa, it was across all cities in North America. We are happy to report, though, that the issue has been resolved. And so our 2024 call volume results will be normalized. We also wanted to mention that in early November 2023, the city implemented a new call transfer function that enables residents of the city to call 911 and to request to be transferred to any 911 comms branch across North America. And the service is proving popular. It's used now about 70 times per month by Ottawa residents. In 2023, there were 3 complaints to 911. 2 of them were related to call delay times. And then one of them was a performance issue. That complaint was also submitted to the Provincial Law Enforcement Complaints Agency. Next slide. So this is our usual performance metric reporting. We have 3 main performance measures in our service level agreement with the Ottawa Police Service. The first 2 performance measures were met in 2023. So a minimum number of 911 call takers were on duty at all times, and also the number of call takers was adjusted according to call volume demand. The third performance measure is that 97% of all calls be answered within 6 seconds from the time a call is received. That measure was not met in 2023. The result was 89%. But this is another measure I do want to unpack with you, though. There's a couple things to point out here. First of all, the 89% is an important improvement over 2022 when you consider the very high high volume that we had in 2023 because of those erroneous calls to 911. And so that represents important work on the part of the 911 comms branch. The other thing to point out is that the City of Ottawa does have a very rigorous performance standard. We haven't found a similar one in Canada, to be honest. Most 911 agencies use the National Emergency Number Association standard, which is that 90% of 911 calls be answered within 15 seconds and 95% within 20 seconds. I'd like to note that if we were to adopt this standard, the Ottawa Police Service would have met it for the last 3 years. And also for 2023, the average call answer time for a call to 911 in the city was 7 seconds. Next slide. Donc, les priorités pour 2024, on était vraiment ciblés sur la transition au service 911 de prochaine génération. Je voulais vous rappeler que le service paramédic d'Ottawa, leur transition est gérée par le ministère de la Santé provinciale, lorsque pour la police et aussi le service des incendies, ils sont eux-mêmes responsables pour leur transition technique. In terms of the transition date for Next Generation 911, Canada-wide, it remains as March 4th, 2025, and that's the date against which we are working. We will be issuing some public communications about Next Generation 911, but this is a good opportunity to remind everyone that for residents, they really won't notice a difference between the old system and the new system at first. As you can imagine, we're going to a whole system, a whole new national system at the same time. The immediate priority is to make sure that this new end-to-end digital system is as stable, as robust as possible. And so that will be the immediate focus. The additional services that are made possible through Internet Protocol will be rolled out at a later date. I think with that, I'm going to thank you again and hand things back to the chair. Donc, merci beaucoup.
Thank you very much, Director, for the presentation this morning. Like I said, we do have one delegate. We're unsure if he is available at the moment, so I'll just call upon Mr. Michael Wood. If you're available, please chime in now. I understand that Mr. Wood may not be available till 11 a.m. So, okay. So we'll just put him sort of in the queue. I will start with some questions from members of the committee. If Mr. Wood makes himself available before we vote, I will hear him. Otherwise, we will just continue with our agenda. So any questions for our staff? Councillor Devine.
Thank you, Chair. Thank you, Beth, and nice to meet you, Mr. Janis. Can you, earlier in your presentation, I heard you mention that typically you can expect a spike of 10% of calls from year to year. when I looked at the chart, you had some years going up, some years going down. A spike of 10% from year to year seems large, considering I know you mentioned it's due to population as well as other factors. I know our population, I swear, I hope our population isn't going by 10% year to year. Can you unpack a little bit more about what might be the factors that would lead to that kind of projection?
Well, we're seeing, across Canada at all 911 call centers, a steady increase in call volume. Luckily in Ottawa, we don't have the same amount of non-emergency calls that we see in some other cities being made to 911. Our population is very good at using the system appropriately. But I think there are different factors. I don't have the numbers in front of me, but we are seeing through the Police Services Board reporting on some higher crime statistics. We are seeing things like an aging population, potentially more requirements to visit the emergency room, things like that. I think these are sort of broad strokes of trends that contribute to ongoing increases in call volume. And I do have to say that the 9 or 10% that I gave you was a bit of a guess, because we don't truly know to what extent the erroneous calls implicated that 18% in 2023.
All right, thank you for that. I do understand that Mr. Wood is available, so we're going to try and promote him at this point. Colleagues, we're just trying to connect with Mr. Wood, who has been texting a member of the committee saying he's trying to get in, but we don't see him in the queue, so we're just going to take 1 second. Okay, colleagues, while our staff are trying to connect Mr. Wood, I'm going to continue with questions from Councillor Devine, and hopefully we'll be able to get Mr. Wood. So Councillor, if you can continue, please.
Thank you, Chair. You had mentioned when you were talking about our switch over to next generation and how that it'll be a relatively seamless process, that the user might not notice much of a difference. It sounded, I suppose, similar. I remember when we had a briefing about the new system for calls and dispatch for paramedic services. And I think if I remember from the paramedic switchover that there was going to be, it's going to be certainly a different process that will lead to better results. I don't remember if that one was going to indicate that it'll be a different experience on the user end. Would you mind just letting me know a little bit more? Because I'm certainly enthused by any improvements that you are helping to shepherd for next gen, but can you give me a bit of a better sense of, if I'm a caller, when we adopt or move towards next gen, how my user experience will be seamless and not much different?
Thank you, Mr. Chair, for the question. So Really, the user experience is going to be identical pre and post next generation 911. When someone calls 911 in Ottawa, they'll be asked if they need police, fire, or paramedic service. And then their call will be handled accordingly, and that will be the same. Yeah.
Thank you. I know that if the delegate, Mr. Wood, had got on, he was going to be likely talking about a couple of things that he's advocating for or has been advocating for quite strongly over the past year or two. One of them being the ability to text 911 in other cities. But I think I saw from your presentation there that ability to, we have him. I'm just the opening act, apparently.
Thank you, Councillor. It seems that we do have Mr. Wood now. If we could connect him, that would be great. Mr. Wood, can you hear me? You're just on mute. If you could unmute. You're still muted.
There we go.
There we go.
Can everybody hear me now?
We can hear you.
Thank you very much. Thank you very much, everybody, for having me. I truly appreciate this. I was on the phone audio version of Zoom because I am at Algonquin College. I am teaching momentarily, but I did want to join first and foremost, and this is very important, but I do believe the most important thing that I can share with everyone is that Director Gooding has been absolutely amazing to work with, and I appreciate her team's efforts more and all of your efforts to do this. I'll give you some real fast background. Many of you know this. 2022, I received end-of-life text messages from my brother in Toronto. He did pass last year. When I did call 911 in Ottawa, I was told the technology was not in place to transfer to Toronto, and I had to call non-emergency. I'm going to add that we currently are in a mental health crisis. And the fact that the city of Ottawa can now transfer calls across North America, you should all give yourselves a round of applause. You guys are all amazing. Moving forward with this, obviously, we need to get this further updated with the texting. I did hear Director Gooding say that, yes, March 2025, the proposed date for mandated date for NG 911 is coming. There is a push right now to delay it till 2026. I'd like to thank Mr. Janis for meeting with me last week as well, too. We had a wonderful conversation about updating 911 because all the lives of the residents in our city and their friends and family across the country have to be supported. With that being said, I did meet with the Canadian Chiefs of Police Association yesterday. We had a wonderful conversation. They outlined some information, and that led to me calling the Minister of Public Safety federally, and him and I will be meeting. I am supposed to be meeting with MP Singh next week as well, too, about 911. So really, at the end of the day, because of the mental health crisis that we find ourselves in, all of us right now know of somebody that is having challenges and require 911 services in another city. For those that know this, I have worked with a women's shelter for women in a domestic violence situation that cannot pick up the phone and call 911. They could hopefully discreetly text 911. All of these services have to be made available. Our whole life is technology. I'm here at the college right now, zooming in on my phone to speak to all of you, which again, I truly appreciate. So at the very least, we should be able to find a way to text 911 in a situation where we can't pick up a phone, whether it be domestic violence, home invasion. And so again, thank you all for your tremendous support. I'm happy to answer any questions that you might have. I do have to teach at 11.
Okay, well, thank you, Mr. Wood. First of all, I want to acknowledge you being a strong advocate for improvements in the technology to facilitate calls from jurisdiction to jurisdiction, but also ongoing improvements. So I really want to recognize your work and your advocacy here within our community. So thank you very much.
Thank you.
Vice Chair does have a question for you.
Yeah, thank
Sure.
you very much for the delegation this morning, Mike. And you know, you gave a well-deserved shout out to Beth and her team on this. But I just want to reinforce what the chair said. Thank you very much for your advocation on this issue, and I look forward to seeing some more success on your end and our end to try and improve the system. So thank you very much, Mike.
You're very, very kind. I truly appreciate it. And again, at the end of the day, you know, this is coming from lived experience. If you were to have a conversation with somebody just about this, everybody that, for the most part, that I've spoken to, they say to me, what do you mean you can have your call transferred? What do you mean you can't text 911? And I do understand the challenges that will come with texting 911, where, you know, down in the US, people are texting saying my Uber didn't show up. And this is going to put additional strain on our emergency services, our PSAPs, public safety answering points. So we do have to come up with a strategic strategy that will not only be there to help the people, but really help everyone despite everything that's going on. So I truly appreciate every single one of you. You guys are all, should be recognized. You're all amazing.
Thank you. And we do have one question for you from Councillor Devine as well.
Mike, I know you got to go teach, so I'll keep it really brief. But before you got on, Beth Gooding was making reference to just how much her work has been complemented by working with people in community. And so you are one of those people in community that is helping the city to accomplish and achieve and advance its own goals. So I know that councillors like myself and Councillor Hill will be eager to continue working with dedicated community activists like you to help the city advance its goals. So thank you for what you're doing.
I truly appreciate it, Councillor, and thank you for inviting me here today. And I'll just also say, in the beginning in 2023, when I was asked to appear before, Councillor Hill was the one that brought me forward. So without everybody's support, again, you guys have all saved lives. There's been 749 call transfer requests since mid-November to the end of September. So please know that tonight, you know, you all have very difficult jobs. So please know when you go home tonight, know that you have saved many lives across our country for family and friends of residents here in our city.
Thank you, Mr. Wood. Thank you for presenting today. We will end the delegation period now.
Thank you very much for having me.
Thank you, sir. And Councillor Devine, back to you.
Thank you very much. Thank you for your patience, everyone. Ms. Gooding, going back to what we were talking about earlier about the approximate growth of 10% of increased calls per year, and I commend Ottawa's numbers. We are delivering, as often with our emergency services, we are regularly delivering service levels above national standards, and I commend you all for that. But with the anticipated growth from year to year spikes, with the fact that we, and if I understand you correctly, we are now delivering that service of text and 911 transfers to other cities. So some call goes through us at some point. With the fact that we are implementing new systems, are we, when it comes to staffing resources, as you look towards, I assume, anticipated growth on a year-to-year level, and your ability to staff and meet that, are you confident that with our projected growth that our staffing levels will be there to take those calls?
Thank you for the question, Mr. Chair. So one of the things that we didn't mention in our 2024 look ahead, but I'm happy to do now, is to share that as part of the city's corporate service review work, we are doing a service review of the city's 911 call intake function. And so we are working with a consultant and looking at precisely what you indicated, you know, forecasted call volumes, staffing levels, pressures, things like that. And so we will be able to report back more fulsomely in the future. Thank you.
Thank you. I have two more questions. One relates back to what Mike Wood was. One of the things that Mike Wood is trying to do, the ability to text 911. And in a conversation I had with him, he made it very clear the kind of instance that he is advocating for if you are involved in a domestic. And you, for any number of reasons, it's not practical or even safe for you to make a 911 call, but you can safely text 911 and avoid what might be happening in that instance. Was I hearing that we had been on track for implementation in 2025, but we may now be pushing to 2026. Could you give me a bit more clarity on what we were talking about, our ability to get to this technology and the current timeline for it?
Thank you for the question. I think it's important to separate the overall transition to NG 911 in 2025 from the real-time texting capability. What Michael Wood was referring to is that there are across Canada hundreds of primary public safety answering points that all need to transition to next generation 911 within the next 6 months or so. And so there has been a request on the part of various bodies to the CRTC to consider a 1-year delay. So that was the reference that Mr. Wood was making to 2026. From a real-time texting perspective, we had always known that that would be implemented after everyone was on the next generation 911 network. And the timing is a little bit hard for us to predict because, like I said, we need everyone to be on the network. We need the network to be functioning properly before we roll out that new functionality. I felt obligated to ask Mr. Janis to add something if he wants to. So I'll ask Mr. Janis to jump in.
No, thank you very much. I think when it comes to your answer, sir, it comes down to the fact that the initial date that we talk about for March is to move all our 911 centers over to the 911 technology. And the technical plans is to roll out real-time texting several months after. So where we stand right now is going to the comments made by Director Gooding was several associations have asked for a delay. And the main concern, to be frank, are not for the cities of the size of Ottawa and Toronto, for example, but more the smaller cities that are still struggling to meet those timelines. So we are tracking from a City of Ottawa perspective to meet the mandated timeline. But when we look at the extension, we don't want to give the perception that we're asking because Ottawa will not make it. That the request was made on behalf of all 911 centers within the country.
Thank you. One last question, Chair. I believe in your presentation, you were making reference to there are instances where people inappropriately make 911 calls, not out of malicious intent, but just not sure what call to make. I remember when we had our briefing on from Ottawa Fire Service, there was a large percentage of false calls, and they implemented measures to address that. I don't assume that for lack of a better term, inappropriate calls to 911 are of the same volume as false alarms for Ottawa Fire Service, but they still are a drain on resource. And obviously, many people are making a false 911 call when they simply don't know what number they're supposed to call for non-emergency issues. So what initiatives could be developed or are being developed to better educate residents about the appropriate use of 911 versus non-emergency calls? And how do we expect that this might help reduce unnecessary call volume?
Thank you for the question. All of our emergency services have various Make the Right Call campaigns. I will ask Director Janis to speak to some of what the police service does to educate the public. They have a really, I think it's an annual campaign where they share some of the calls that should never have been made to 911 as a way to educate the public about what not to do. But I'll hand it over to Director Janis.
No, thank you much, Mr. Chair, for the additional question. But I think that the efforts that we are all doing is actually happening at the national level because although Ottawa receives calls, we also receive calls from other cities. So a lot of the efforts that we're doing right now, as was previously mentioned, is the social media approach. But at the federal or at the national level, we're also looking at strategies within some of the other Next Gen 911 group to do some stakeholder engagement to be able to communicate to the people when to call 911 and also to your point earlier to what are the potential impact to them for NG 911.
Thank you. And thank you, Chair.
Thank you, Councillor. Director Janis, can you just talk to me about, given the sheer volume of calls, first of all, back up. 411,000 calls in the year is significant. 3 complaints, statistically 0. And that speaks to the professionalism and service of yourself and your team and all the staff in the call center. We do have calls that exceed the benchmark that we have for amount of time to be taken. How do you monitor this on an ongoing basis? So let's say I call today, legitimately, I wait a minute, which exceeds sort of the acceptable timeline for my call to be taken. How do you monitor this on an ongoing basis? How do you know when to add resources to the team? Can you just explain that to the committee?
Yes, and thank you much, Mr. Chair, for the question. So I will divide my answer into 2 areas, the operational side that you're just talking about versus the follow-ups that we also do. So on the daily operations, as part of our service level agreement with the City of Ottawa, we do have a clause in there that the Ottawa Police will realign resources as needed toward 911 if there is a significant call. A significant accident, for example, could generate 20, 30, 40, 50 calls, and we realign dynamically the resources to be able to ensure that the calls are met. That is the responsibility of our frontline management team and something that happens on an ongoing basis every day. To address your initial question about how do we monitor? So for example, if you did call today and your call was, waited longer than it should have, as a byproduct actually of COVID, we initiated weekly reports to our management staff that addresses all our intake numbers, including 911, that indicates the longest time waiting as well as the average and the amount of calls. So on a weekly basis, we're able to look and get sort of a quick glimpse of the previous week to be able to identify issues. And as part of that weekly report, we also look at staffing and other factors that might actually have impacted it. So a longer call waiting is not necessarily an indication of more calls. It could be a calls that are longer or a specific event, and we're able to address those matters to ensure that there's not any mitigation measures that needs to be put in place, or in fact, actually any corrective measures depending on what the actual cause was.
Excellent. Thank you for that. And thank you for coming today to provide that context. It's very important. Okay, seeing no other questions from committee members, the recommendation before us is that the committee recommend to council that we receive this report for information. Is this matter carried?
Carried.
Thank you, colleagues. That concludes the substantive items on our agenda today. The next item is agenda 5, in camera. Do we have any? There is no in camera matters. Notices of motion. Are there any notices of motion for subsequent meeting? Seeing none. Inquiries. Do we have any inquiries this morning? There are none. Any other business? Seeing none. The next meeting of this committee will be November 21st. It will be solely dedicated to the 2025 draft budget for this committee, which covers all services within the Emergency and Protective Services Department. So I look forward to seeing you then. And on that, given that there's no other substantive business, the meeting is now adjourned. Thank you, everyone.
Thank you, Chair.